From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed. We come to you on 105.9 every Saturday, 10 to 11. We also re-air Sunday, 2 to 3. So thank you for all joining us. We talk about all medical issues, any upcoming foundation things that are happening with Toomey or anything like the Irish Festival and such as well. So we cover everything we can. Speaking with our elder community out there in town and anybody else that cares about all the changes that happen in medical. So thank you for joining us. I want to thank community broadcasters for giving us the forum to talk. Also want to thank our sponsors, Palmetto Toomey, Reliable Medical Equipment, Tri-County Home Health and Hospice, and At Your Service Home Care, which will be our topic. So for those of you scoring at home, we will be talking about home care with At Your Service in just a minute. I do want to thank Reliable Medical Equipment last week, 934-9212, 246 Broad Street. Go by and see Aubrey and Martha Joe. Great job last week informing us of all that they do for the last 17 years. Also have a location in Manning on 37 West Rigby Street. Phone number 803-435-9927. So help support them in the community. So today, what we want to talk about is we want to talk about home care. And home care is when we assist people in their homes with daily activities. This can go anywhere from helping someone get to the grocery store, help clean the house, help dress, help bathe, assist them getting to doctors' appointments, medicine reminders, and such. And I think to really define it, we kind of have to define what it is not. And when we talk about home care, we sometimes confuse that with home health. And we've had many people on the show to talk about home health. Home health, to differentiate, that is care that is provided at the home, similar to what we're talking about with home care. However, this is done by nurses, healthcare professionals, therapists, physicians, and such. A good example of home health, if you happen to be someone that received a knee replacement, you will have your choice after your surgery to stay at home, and you might be visited by a nurse who comes into your house to help the sutures as they heal. You will be visited by a physical therapist who will come into your home, who will help you to rehab your knee. And what they do is they have a set of goals. And once you meet those goals, so let's just say that the goal is to get up and play golf again. Once we get you up and walking and getting that knee back in working order, the home health provider then will leave. And generally when they're there an hour and a half to 2 hours a day, but they're not someone that's going to stay in the house and be a caregiver. They're there to do one certain goal, and then they go. Another term that is confused sometimes with home care, because it is in the home care, is hospice. Hospice/palliative care. And we've had that topic on the show many, many a times with Kim Price and Cheryl Fluharty and such with them. But hospice is when we're in the home and we've made a conscious decision that we're going to stop most medications, if not all, that help extend life. And the idea of hospice is to keep you comfortable. But as well, it is not someone that's going to stay with you 24/7 or as many hours as you need. They're going to come in, they're going to perform a duty, they're going to set a goal. At the particular time, you will meet more of the staff, but for the most part, you're going to be left alone. And this procedure can take a day, it can take an hour, it can be exhausted over a year and a half. And as we talked about on some shows, people even graduate and come off hospice. But the point is, yes, it's in the home, but it is not home care, as we're going to talk about today with At Your Service. So, as our first segment comes up, I want to introduce, we have three young, lovely ladies in the studio. I want to start off with Renee Bennett. Renee Bennett works at Your Service Home Care. She is a medical assistant she's going to give you a little background on her. We're going to talk a lot in detail over the next hour about what her duties are and what all that she's performed. But Renee, how are you doing this morning?
I'm doing great, Jeff. Thanks.
Well, good
how are
seeing
you?
Thank you for coming in. Give our listening audience a little background so we can understand Renee Bennett.
Hello, everyone. I am a mom of 3. I've been dealing with this business for over 17 years, including family, resident assistant. I've worked for a home for 8 years. And now I'm with At Your Service.
Yay!
Hey.
At Your Service is basically the same, a little different from a resident assistant home. The residents get to be comfortable in their own home. They get to run free.
Let me ask you this. All right, Renee. All right. Because we want some personal, too. You got 2 kids, is that right?
Yes.
And they graduate? 3?
Yes, I have twins that's coming out this year in June.
All right. Are they athletes? Because you're a former athlete, too,
yes,
right? I would love that.
I'm a former track runner.
Little hoop player? Didn't you play a little basketball?
I play a little ball.
A little ball, okay.
My daughter plays basketball for Allen University.
Awesome.
One of the twins plays football, and the other one is a track runner.
In Crestwood?
Crestwood.
Oh, we'll give a little shout out.
Nice.
Thank you, Renee. So, Renee, we'll talk about all the duties in your experience and how that has helped you at Your Service and how you help At Your Service. Debbie Ketterman. Debbie, how are you doing?
Hi, Jeff. I'm fine.
Good. Debbie, you are new to the staff with At Your Service, but you bring a lot of different parallels together. Tell us about your background, how long you've been in the community, and kind of your role marketing here for the At Your Service.
I've been in the Sumter community all my life, and I started with At Your Service as a caregiver recipient. My mom was on hospice, and I needed some help in my house, and a friend told me about you, so I called, and that's how I came to know about At Your Service Home Care. And I really appreciate everything you've done for us. And since Mama passed away, I needed something to do, and I couldn't think of a better place to work than with you.
Very good. Christy Waynick, we're coming up. We got a minute, so you're going to have to be brief. But At Your Service,
always do that.
Give us, I know it. But we've got another segment. This thing goes on
right
forever,
ahead.
even
I'm
when it goes off the air.
30 seconds now.
Yes.
Go ahead.
Give him your background. Christy Waynick, General Manager at Your Service.
I have a background in having originally worked at Toomey Hospital a number of years ago in the medical records. I have background in the legal field as a legal assistant, so I am more the documentation overall seer that makes sure all the working parts work together smoothly, cohesively, and am support for everyone that's involved in the company.
Very good. We're coming up on our first break. Medical Forum, we're talking home care. I'm excited about this subject. It is probably, if not the biggest, one of the biggest growing in our medical community. We got At Your Service here, and we'll be back right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back. We're Medical Forum. Thank you to Community Broadcasters 105.9 for giving us the forum to talk about all the medical issues. And today's topic is home care. For those of you just joining us, we have At Your Service Home Care. At Your Service Home Care, located here in Sumter, 1250 Wilson Hall Road. Phone number 803-607-9677. Check them up on the web, www.ays/homecare.com. Now, when we left, make that dash. If I say slash every time, I think people know. We get a lot of emails, so you know to ignore me on my reading. Dash.com. When we left, we have Debbie, Renee, Christy from At Your Service. And what we want to talk about, first of all, let's talk about the home care industry. I mentioned as we're going to break that it is probably as growing an industry as there is out there. According to survey, and I'm looking at one right now and just reading it here, there's a number of reasons why. And I think number one is the millions of people that are falling into the baby boomer range, and that's anyone born from 1946 to 1964. So that's a lot of people. So if you're 52 to 82, pretty much you fall into that. I think we also know that we see a lot of prescription drugs that we don't see a lot of cures, unfortunately, but we certainly see things that allow us to continue to live longer. And education is a key. People are living longer. We've had shows with the Alzheimer's group on. There are 6 million people diagnosed currently with dementia, which I think we'll talk about later how important that is with home care. It's affordable. Now, it's expensive, and we're going to get into it because I'm going to tell you some real bad news in just a second. But when we look at nursing homes and we look at some of the alternatives, it is affordable with that. The third part, I don't know one person that I've ever met who's come screaming in saying, I want to go to a nursing home. So people want to stay in their homes. So how do we keep someone possibly with dementia that touched 6 million people? We've got 10,000 baby boomers between the age of 1946 and 64, 10,000 a day that are turning 65 years old. That's a lot of cranking out people on that. And also it's convenient. I can stay in my house. We don't have to go through the arduous process of moving into a nursing home. And I'm going to tell you, here are the two bad news, so we get those out of the way, and then we can get back to At Your Service and talk about what all they do to help alleviate this. Number one, Medicare does not pay for this. And by being an owner of reliable medical equipment and At Your Service, I see it every day, and I see the distraught look on the face of the daughter, the son, the wife, when fortunately the husband or the person has lived through a stroke, through congestive heart failure, an amputation, what have you, or dementia, the aforementioned. and they find out no insurance. And everything that they've saved for, whether it's to give to their children, their equity in their house, has to go into money to be put into a nursing home. And then the second part of the bad news, nursing homes, you can look around the Sumter community. You know, we hit Sumter, Florence, Manning, and Kershaw. There has not been a new nursing home that has been built since 1996. So nursing homes are in very, very, very high demand, and there's not a lot of slots. So negative, Medicare doesn't pay, and B, it's not as easy as saying, we'll just put Dad in the nursing home. We'll explain it to him later. There may not be beds available. Which brings us to home care. At your service, home care, 1250 Wilson Hall Road. Christy Wainick, tell us about the solution to these problems I've just brought up that you as general manager at your service, home care, can help alleviate these. And tell us, just start from the beginning, the concept of the company and what you're capable of doing.
At Your Service Home Care is based on the concept of a concierge, a steward, and a guide. We are there as a one call that a family would need to make. We can put in-home care in place for them. We can provide the stewardship to make sure that they are comfortable knowing their loved one is safe and there's someone they have that is trustworthy, on time, and is going to do things the way the family wants them done within the home, and as a guide to, if we don't do the particular service, such as legal assistance, some financial assistance, we know the trusted resources in Sumter where we can refer them to make it an easy call. We can put the package together. We work with all of these various providers in town, and we're here to provide the family support, the personal care of the individual needing the care, and we work with families on what they need and what they can afford and what is going to work best for them as a whole to be a complete support for all involved.
Gotcha. I got you. Debbie, you mentioned earlier that you actually, now you've come on board as helping with marketing, helping with a lot of things at your service. In as much detail as you want to include, let's talk about, you mentioned about your mother's situation. This was thrusted upon you. You're not a caretaker as far as in the certification by trade, correct?
Correct.
And now we've got a mother who desperately needs your help. Tell us about the first measures, because there's a lot of people that would love to know that are either in that process or will be in that process. So let's talk about what happened. How did you ended up having her come home? Obviously,
she did. She fell and she broke her pelvis and her shoulder, and she had to come to my house to live. And during that time, she was diagnosed with bone cancer also. So we ended up going on hospice, and I thought, well, hospice has volunteers. Well, hospice didn't have volunteers that would come into the home and sit with her while I went to the grocery store or I had a doctor appointment. So I had to start calling around to different companies that I had read about, and I had a hard time getting people to return my phone calls. So I had a friend who told me about At Your Service. They were new, and I called, and y'all came out to the house, met with me, and told me what you could provide for me and for Mama. And
let's touch on a couple of things that you've said. And I think, because I know your personal story as well, you did the caretaking for almost a year yourself.
A year and a half by myself.
Yeah. So for 18 months, you're pretty much every move that you have to make. I know you have 2 children in high school and a husband and a house and your life and everything else going on. And that's kind of step number 1 that people have to look at. Do I, for lack of a better word, have to stop what I'm doing and be the caregiver and then learn that as well? And as we come up on our second break here, I want to come back and talk about that, because it's something that hits everyone. There are 3 or 4 choices here. And 1 is to do it ourselves. 2 is to institutionalize, and I mean that in the best possible way I can. And then 3, for a company like At Your Service to come in. So we'll be right back, and we'll continue talking about home care.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
We're back on this Saturday morning. I want to thank At Your Service Home Care for taking their time out, educating us on home care. When we left, we were talking with Debbie Kinderman about the situation that happens so often, and I've seen it for 17 years in medical equipment. I've seen it for the last year and a half with At Your Service Home Care. We instantly become caretakers. And what's happened in her situation is her mother had a fall. Her mother then was making a recovery, and then to, I guess, make matters much worse than a diagnosis of bone cancer. Mother moves into house. You instantly become a caregiver, and a caregiver is not 9 to 5. Is that correct?
That is correct.
And I think it's a big thing. It's not Monday through Friday, correct?
No, 24/7.
Right. And after 18 months, it's time. I need what a key word in ours, Renee, Christy, respite. And respite simply means I need a break. And that break can consist of 2 hours every other day, 2 hours every day, one weekend, one full week, so I can recharge my batteries. No different than anyone who has a job and they take vacation. You need those little breaks. We all have our Saturday and Sunday where we don't want to be bothered at work, our 9 to 5, Monday through Friday guys out there listening. So, Debbie, it's 18 months, which is yeoman's work. Nobody would expect someone, so hats off to you, number one, on that. You make the call to At Your Service. Christy, what happens when you got the call?
We scheduled a time to go and to the home to meet with Debbie, meet her mom, see what, and they had a beautiful relationship and had worked out such a wonderful routine of the care, what worked, what was most comfortable, and made the decision on what attendance we felt would work best, brought them in, made sure that Debbie and her mother had the ability to choose who worked best with personality-wise, because you're going to spend time with that person.
Well, let me come back to that. Now, Debbie, so she comes out. I think the concierge, the aspect of that, the great listeners. So you are ask a series of questions, because I remember us talking before the show. So it's a series of questions that went from anywhere from obvious medical situations, cancer, does she have dementia, is she incontinent, does she need this, to maybe some just simplistic, what kind of music, what kind of books, what kind of TV shows. So explain that from your perspective a little bit.
I believe that was to help them choose the attendants to have something in common with Mama, like what kind of music, who she grew up listening to, what her favorite flower was. And they brought it together because they brought flowers to Mama then, and it was her favorite flower.
Cool.
So they do listen.
So, Christy, once you got that information from Debbie,
yes,
what happens then back at the old At Your Service headquarters?
Then I get together with the attendants and Renee as the medical assistant and say, this is our client. And the client's the whole family, not just a patient. This is who the daughter is. She has daughters she's trying to spend time with and a life she needs to be able to do. And then this is the personalities, this is the household. They have 4 dogs, and they were just as much a part of the family. And then we sat down and decided which attendants we felt would be the best to go in and work directly with the family as a unit.
Okay, so Renee, let's pop you back in here. You're a medical assistant. You've been in this field for 17, 20 years, what have you. Your strength is being that person who comes into the field, knowing from the information that has been given what set of skills are needed to be able to take care of Debbie's mother in that respect. So what do you feel, and I'm trying to, when you two get together, you're giving the information and then you're saying this is the list of clients. And I think one of the things that I like what happens there, it's not just one. You're looking at, and obviously when we have 24/7 care, you're finding maybe 5, 6, 7, 8 different people to fit this need, Renee?
Yes, sir.
Yeah.
And that's where the comfort zone come in first and foremost. I want the client to be comfortable with me. Get to know the client.
Right.
Then we talk. I do what I need to do during that shift, and we just kind of basically go from there. So it's basically comfort first.
So basically, we've got call into the office. You go out, do the background, get all the information. You two huddle up. You know the attendance. You know what the needs are. From what Christy said, you two make a one more trip back out to Miss Kitterman, and you bring some of the prospects. Is that correct?
That's correct.
All right.
We introduce them, so no one just shows up on a doorstep unintroduced. And with Renee as the medical assistant and representative for the attendants in that group, she assesses to see, okay, medical requirements. We need this type of person able to provide this level of care. And then we talk about the personality and the fit and the comfort, as Renee does, because she does both once she's in a house or places someone in the house.
Gotcha. Now, Renee, let's go back as we sojourn into the third break here. A caregiver. Now, Debbie, we talked about you kind of were, man, I learned how to be a caregiver. And I remember going out and meeting you, and you and your mother had techniques that you basically adapted out of need and how you like to have it done, how your mother felt comfortable, because one of the moves is you did have to help her up from her bed and such. A medical assistant, a certified nursing assistant, a compassionate caregiver, someone who also learns on the fly. What are some of the criteria? Tell me something that, Renee, your crew that you work with, they're capable of doing. For example, let's just say I called you and said, I have a brother who unfortunately was in a car accident. Sometimes we think of just elderly. I have a brother who has been in a car accident. Are you and your staff capable, if he needs a lift, to get him out of his bed to a wheelchair?
Yes. I have dealt with lifting patients with lift chairs, lifters, wound changes. We had patients with bed sores.
Okay.
We have to change, keep clean. vitals, medicine.
Well, I'm gonna stop on medicine real quick. With your background, you have the ability to administer medicine. Is that correct?
Yes, sir.
And for the most part, we're a CNA, which is what most we have, medicine reminders. And that's something I think your company, Chrissy, you guys talk about.
That's correct.
In the last 30 seconds we have here, give us a list if I'm listening out there and saying, what are the skills where you start and stop from home health?
We have basic caregivers with no certification for companionship up to CNAs, which is Certified Nursing Assistant, CMAs, Certified Medical Assistants, and PRN nurses to come in and oversee patients.
She's Christy Wainick. They are at Your Service Home Care. Want to thank Palmetto Toomey for all they do. Want to thank Tri-County Reliable Medical Equipment. When we come back, we'll talk about in the medical field, where does At Your Service Home Care provide in-home medical assistance, but then not beyond it? And we'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and to have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back again on Saturday morning with Medical Forum. I want to thank community broadcasters for giving us the opportunity to come on here. We come at you from 10 to 11 on Saturday and then also rebroadcast on Sunday 2 to 3. Talking about home care. And we've tried to disseminate the difference between home health, hospice, and home care. Home care is coming into the home and staying in some cases. And in some cases, every other day, a couple hours, giving a caretaker who's the main caregiver, some respite care. We're with At Your Service Home Care, locally owned, operated, 1250 Wilson Hall Road, 803-607-9677, AYS-homecare.com. So when we left, Christy, we were talking about, between you and Renee, volleying back and forth a little bit on CNAs, MAs. You can get nursing where needed. Some people just need compassion. Some people just need a good friend. So talk to me about where At Your Service starts with the care that they're able to give and where it stops.
Okay, At Your Service is set up to provide, and I believe Renee could give a perfect example with one situation where we provide round-the-clock care, and it ranges from companionship hours up to wound care.
Fill that in, though. Give me
we have
dressing,
a period of time.
Bathing, talk to
companionship,
me.
Just being there, make sure we get breakfast, lunch, whatever. Showering, very specific requirements for the level of care to do the showering. There is wound care involved, so you need certification and understanding and training to do the specific wound care. And because of a inability to, or basic paralysis situation, the ability and level of training to transfer and move him from one area to another safely.
Okay, I'm looking at the brochure here. Offer respite care, meal planning, medication reminders, changing, dressing.
Yes.
Take him to the barber shop if you're a guy. Beauty shop for the girl. So transportation to the doctor.
Yes.
All of these things are available. Now, so we're not confused. Helping and assisting with wounds, but not doing home health. You're not a home health operation,
We
right?
are not home health.
Right. Working with the wound center, possibly. Transporting, listening to directions, helping them maybe with nutrition if they're diabetic. Is that correct?
That is correct.
Fixing a meal. I'm hungry. Help me out. Okay. And overall safety, just making sure. And I think the other part that's nice, I know there was a client that needed a power chair the other day, and assisting with him to get medical equipment. We've had people that need help with lawyer directives, need a home health, going ahead and lining that up for them. So not only is home health and hospice a very good avenue that you can kind of help each other, you also can help them find that where needed. Renee, at the break, I used and my brother's fine, by the way. I don't want to jinx him, but using my brother as an example, he was to get in a car wreck or have an accident that left him without use of his limbs. You deal with a patient you mentioned all the time. Talk us through this patient. We won't name names, but talk us through his injuries, where you have to help him. What's a day in the life of Renee? That rhymes too. Not bad, huh?
Like that.
If your name was Faye, it would have worked too. But talk us through a day with him so we can kind of imagine kind of what you do.
Okay. This patient is paraplegic.
Okay.
I get him up ready for the morning. I change and clean his wounds, pack them, wrap them, make sure it's dry and protected. Get him dressed. Then I use the lift to get him out the bed.
All right, so because there's a lot of people out there that you've been in the business a long time. I know some of your dog. So he's in a bed and a lift. Describe, this is a piece of equipment.
Power lift, yes.
And let's talk about that real quick. How do you get him out? How do you get him in it? How do you get him out of it?
Okay, it's
like a sheath cloth, is it?
Yeah, it's like a protector lift, and it could hold up to 300 pounds.
All right.
So I put the client underneath on top of the lift carefully, make sure it's all locked up, safe and secure, and I lift him carefully, put him in the wheelchair after all the morning clean, and put him in the wheelchair, make sure he's positioned because the wound is in the back. Position him comfortably, and he gets started on his day. Make sure throughout the day he eats. He take his meds, but throughout the day I have to make sure these wounds are clean and dry.
Now he's a paraplegic, right?
Yes.
And generally with that, we don't have a lot of things. Just to differentiate, a quadriplegic does not have use of his arms. A paraplegic does, but not from the waist down. So let's talk about that. Is there a catheter involved? Is there a...
Yes, he has a catheter. He has a colonoscopy bag, which I probably change 2 to 3 times during the day shift while I'm there. The catheter has to be kept clean and changed when needs to be. So he does have all those.
Okay. So this is kind of the example that we talked about, mine being a fictional, I guess, from my brother's situation, but you live it every day. So you get there. What kind of shift? How long are you there?
7 a.m. to 3 p.m.
Okay, now this is 24/7 care, correct?
Yes,
I mean,
it's around the clock.
so here comes someone into 3 and then on around, and it just keeps looping around. So that's so Christy, a little pressure there. What happens if no one shows up?
Basically, there is no option to not show up. It will be.
There you go.
It will be anything from if I receive the call at the office, we have an on-call that is in place, ready to go. People can have flat tires, and we understand, but we have on-call. We have a standby. Should that on-call be sent out for any reason, we have a standby that immediately comes on, and there is no non-coverage for clients.
Okay, so you've got because obviously, Renee, you mentioned your hours 7 to 3. So you've got high school kids. You just mentioned that.
Yes.
You know, athletes.
Yes.
Athletes fall, break things. Been there, done that. So he has an emergency, and Keith, is your son? No, what's your son's name?
Andrew.
That's right. All right. So, but if you have a patient that needs your help, and they're counting on you, and they're 24/7, in the description that you've done, we have a backup plan.
We have an on-call that is scheduled 24/7 a day, and then we send them out immediately because the rule and the guidelines are you do not leave any client unattended. You have to stay in place until the relief attendant is there, and that's why we have the on-call, we have the standby, and then we have others available.
Awesome. Chrissy Wainick, Renee Bennett, and Debbie Kitterman. We're coming up on our last segment. I want to talk on dementia as we come up on our last segment because I feel like that's probably a very big patient load for you. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care. WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We're back for our final segment on Medical Forum. I'm your host, Jeff Reed. We've got At Your Service Home Care. We're talking about home care and all the service that you do from, I don't want to call it simple, but light housekeeping, which believe we were talking a break. We've had people that call us up that, not to kill two birds with one stone, but man, we can have someone watch and give me my respite time while the house gets clean, and I save money on a cleaning service. So it's not to diminish it. It's a very important part. We're there to help with light housekeeping, to do the dishes, to help with laundry, to do laundry. Not there to reshingle a roof, but certainly help keep a place clean. And I know that a lot of elders love a house clean, and that's so very, very important to them. And Renee, you just explained in great detail the other end of the spectrum. We're talking about using a patient lift. We're talking about helping with wound care. We're talking about medication reminders. We're talking about a gentleman that does not have use of his arm. So we have all the things that go with that, from power chair to bathing to all the things that go through there. Dementia. We talked as we went to break. That dementia right now, it's scary. We're not making much headway towards dementia training. There's some medications out there to help, slow it down a little bit. But again, 6 million people being diagnosed with dementia, and not a lot of avenues to go. Maybe it's just because we're living longer, and that's why. I gotta believe that's a big part of your business, Christy.
Yes, that is a tremendous part when it comes to mom was good right up till mom wandered out and couldn't remember how to go get back to the house, or mom got in the car and drove off and then couldn't remember how to get back home. That is an increasingly large part of the phone calls that we receive.
And while we're talking about it, Renee, as a CNA, Christy, when you go out and you examine the house and you see the patient, give some of the listeners the different levels of dementia. I know I'll give a personal standpoint. I've been in houses where a gentleman is just as nice as can be and will jump from subject to subject, and some of the things he says, someone that's known him for a great deal of time will say that never happened. No, he wasn't in Paris, or he didn't do this or that. Other end of the spectrum, as we start getting into the later stages of dementia, it can be quite violent. It can be scary in some respects. So you mentioned about the wandering. Talk to us about any clients and some of the things. So if I'm listening out there and I'm thinking, maybe I can handle Dad one more year.
Right.
What are some of the problems that persist?
It's several of the families or the clients that we work with, they have the basic dementia, and that's where it starts. And they notice in the evenings that sundowners, which is where the sun literally is going down outside, in the mind it seems to be going down. The confusion increases, and it becomes kind of the new normal for the family trying to take care of mom or dad. But it is an increasingly advancing disease process, and it is only going to get worse. And that's where we step in the beginning, in the middle, or as it has advanced, to provide the levels of attention that someone with dementia or even up to advanced Alzheimer's require, because it can become violent. They can become very complacent and have outbursts. We
had Sam Wiley, who's the head of the South Carolina Alzheimer's Association, about a year ago. He's going to be on in a couple months as well. 85. Anybody who is 85 and older has some sort of dementia. So it's prevalent, and with medications, and we talked about it, a little more knowledge, everybody is living a little bit longer. You women are killing us men, by the way, literally. I think we're about at 77 or 75, and you're at 82 now, or what have you. So, and we talk about that, but it's a very, very, it's just the facts. In 2020, we look at life expectancy for another 5 years or so. With dementia, it just steals everything. And I think that with Alzheimer's and dementia, it just steals the mind. But it doesn't negate, in a lot of cases, especially for men, their strength. So, Renee, I'm sure you've got to be part politician, part psychologist, and part Roman Greco wrestler sometimes, because there are some violent people. And here's the negative, too. Nursing facilities do not want the patients as much, and I don't mean that bad at all with them. They've got hundreds and hundreds of patients, and What I like about what you guys do, you give one-on-one care. And a dementia patient, especially as I've described, needs that. Is that correct?
That is very much so correct. Example, at the nursing home that I worked for, we had a Alzheimer's patient. He was very irate, violent, and he was aggressive. We don't have time to deal with one patient because we have 50 other patients to deal with. So that's where At Your Service come in. We deal one-on-one, so if they do suffer these signs that I just named, we get to deal with them one-on-one, only that one client. So it's a little bit more easier
Very good.
At home.
Very good. And, and it's going to get nothing but greater. You know, I think they see Alzheimer's in the next 10 years almost doubling. And to be quite honest, just from speaking with physicians that have been on the show and dealing with the Alzheimer's Association, that 6 million seems like a very paltry number. I think they're a much higher number, and so many other people that haven't been diagnosed per se with that. We got about 3 minutes left. So At Your Service Home Care, Wilson Hall Road, home care coming in, going to help with house cleaning, going to be taking people to the doctor, going to be looking after the patient. Great example, my brother lives in Chicago. I live in South Carolina. Obviously, my mother's 71. She's in great health, knock on wood. But if something happened to her of any of the aforementioned things that we've mentioned, I sure would like to know that there's a company like At Your Service, that I can be there, I can call them. I love how your service to keep, you go in, you have the concierge service where it's one call for me.
That's correct.
I call Christy, I need Mom. It's her birthday, which I do forget my mom's birthday all the time. And call up, you call the flowers, arrange for her. She needs a doctor's appointment, you can set it. She needs wound care, we have people that can help with that. She needs out of a chair, one-stop shop. Correct?
That's exactly correct. We can line up everything from flowers for her birthday or just to cheer me up. She seems to be a little down. We can see them for the family members that are out of town and keep them up to date on what's going on with their mom or their dad or a sister that's down here, and they don't see them every day. We're their eyes and ears to give the care that they can't physically do for their loved one themselves.
She's Christy Wainick, Renee Bennett, Debbie Kitterman, Time Flies Biomedical Forum. We have 10 seconds left. Contact information, Christy.
The address is 1250 Wilson Hall Road. Phone number is 803-607-9677. Website is www.ays-homecare.com.
Awesome. Thank you very much. We'll see you all next week on Medical Forum.